Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us today.
Thank you.
I appreciate your willingness to take on a leadership role in a department that's impacting every single American's lives today, and we really need your help. I want to ask you specifically for help with Indian Health Services, because they are failing our Native American tribes. And in South Dakota, we have third world country delivery of health care. And even though we have a new administration, we haven't seen changes out of that department, and we need to fix it, and it starts with leadership within the agency, and I'd love to have a longer conversation with you about that. In fact, I'm going to submit some questions for the record. If you would answer those for me, that would be great, because I wanted to talk to you about health care today in a broader perspective, and because I want to associate myself with the comments of Representative Jenkins and Representative Smith on the struggle that we have in rural America in delivering health care and making sure that services are there. And we've heard the other side of the aisle talk today about the fact that Republicans are to blame for increased health care costs this summer, that Republicans are to blame for individuals who are not covered under health care. And we know when you talk about coverage, that doesn't necessarily mean access. I talk to South Dakotans every single day that under Obamacare, maybe have a policy, but they can't use it because their deductibles are so high. They have no access to those health care opportunities in front of them. So I would like you to discuss, first of all, and clarify the record of what we've heard here today. We're operating under current law and the challenges that we face delivering health care to individuals out there and who are struggling. And if the legislation that we passed through this committee was put into place and we repealed the mandates, repealed the taxes, gave some new opportunities for the marketplace, how that would change our perspective and our opportunities in the future. I would just love to hear you, because you have the experience. Now you're on a different role today. You're sitting in a different chair. Tell me about the changes that we could see if we did health care reform and signed it into law.
Well, I think it's important, and I thank you for that, because I think it's important to think about what the mission is. What are the goals? And the goals are, again, to make certain that every single American has access to the kind of coverage that they want for themselves and for their families. So through the series of subsidies, tax credits, whatever you want to call them, we want to make certain that each American has the financial feasibility to be able to, one, purchase that coverage, two, to be able to purchase coverage that they want, not that the government forces them to buy. So that what the federal government says is right for one person may not be right for another person. And it's so important because health care is absolutely unique to each and every individual. So the kind of concerns that individuals have, and the fear that they have about getting sick and not being able to afford coverage, we need to take that away. The opportunity that we have to provide that kind of reassurance to the American people through a system that allows for that coverage is so incredibly important, and that's our goal.
One of the Democrat members of the committee stated here today that the high cost increases that we're going to see this summer are to blame because of Republicans. Would you blame that on Republicans or current law?
Well, the current law, as we demonstrated through the department, has shown doubling of premiums and significant increases in the deductibles, which make it, as you said, many people have coverage but no care.